Good morning, good afternoon, good evening. This is Dr. DeShavo reaching out to you for week 7. Just a brief reminder, in week 6, you do have your exam. At the bottom, make sure you finish that. Don't forget to go through the proctoring service RP now. If you want more information, I did post in week 6 announcement all the information necessary. So, looking at Module 7, you have 2 discussions to pick from. Please, guys, follow the directions. There's a very specific list of directions. People are missing very easy points. Also, try to really describe the physiological processes. I have some people just listing, well, here's the disease, here's the signs and symptoms. Well, what does that mean? Just give a description of that. Remember the word length, remember the amount of references that you need in the proper format. They need to be done to get the points, but it's pretty self-explanatory. You don't want to miss those points, okay? So reread those directions for these case studies / discussions. All right, looking at the content. Renal and urological systems, there's 3 sets of PowerPoints. The thing with the kidneys is, and this is something that helps some people, remember that it's filtering the blood. So there's 2 options. You can either retain substances that go back into the bloodstream, or it can be filtered through the kidneys to be excreted by the urine. Okay, keep that in mind at every point when you're studying. That's the whole goal. It releases hormones as well, which we'll touch upon briefly. But you're either retaining substances or getting rid of them. For example, let's use salt. Salt's an easy one. Where salt goes, water goes. So if your body doesn't have enough salt in it, the kidneys sense that, they retain more salt, which retains more fluid. Okay, and there's other processes to retain the fluid. If salt is excreted, salt will leave the system. The other concept that's important to know with the kidneys is there are substances which should not be filtered, such as glucose. As you all know, if you find glucose in a screening or a test, something is wrong with their glucose levels, namely mostly diabetic. They can't handle that much glucose. Glucose only gets spilled out when there's too much for the kidneys to filter. So keep in mind that balance. The other thing is it helps to balance electrolytes in the body, helps to balance fluids in the body. We filter our blood every 45 minutes. It's just unbelievable. Pediatric renal function will be obviously different than an adult. I'm sure you're all very aware of that. And then, of course, as we get older, there's differences with the urinary system. Usually not good, unfortunately. And that's something we'll take a look at as well. Once again, great to review these objectives and also all of these as a review and kind of use them as a way to study. And we will pull up the PowerPoint notes really quickly and just go through them. This is the structure and the function, which is like the easiest part. Just going through and naming all the structures, where they are. It's pretty easy, kind of point and shoot stuff. Pardon me. Now, the thing that is a little tricky is you have the whole kidney itself, but inside you have the nephrons. And those nephrons will be the filtration workhorse of the kidney. So you got to memorize these gross or large structures, but then you also have to realize a nephron is a teeny tiny microscopic unit that you need to understand the structures of so you can understand how the blood is filtered through that nephron. And you can understand if we bring blood in, how it gets out. Do we keep substances in the blood or does it go out through the kidneys? The different blood vessels of the kidneys and how that nephron functions, okay? And the glomerulus is part of that nephron. That probably sounds a little bit more familiar to you. The glomerulus or the glomeruli, I should say, are the teeny tiny capillaries, I'm sorry, I've had enough coffee today, capillaries that bring blood in, a part of that capillary system, I should say, and they're a little bundle of blood vessels. There was actually a little picture here. Where was it? There it is. Okay, so this is the nephron. Here's that little glomerulus. That probably sounds familiar. That's where the blood vessels are. The glomerulus is the blood vessels. And the blood, teeny tiny capillaries, we filter the blood, and then if it's going to stay in the blood, it goes right back out. We have a blood vessel that comes in and goes out. And if it leaves the glomerulus, it'll go out into the tubular system. That'll be excreted into the urine. So it's just a little bit of a difficult concept I wanted to explain. Okay. More structural parts of the kidney. Know the hormones. That's an important thing. Erythropoietin should be in there. Oh, it's the next one. Okay, good. And keep in mind, it's important for the creation of vitamin D. Some of you might know that if you know people have kidney damage. So it's part of the process to create and sustain our levels of vitamin D, which are super, super important. Okay, review. I have some other questions I want to look at, some of the tests and the aging. So that is a brief review of 31. 32 is a question I wanted to look at. I thought these questions were a little tough, I ain't gonna lie. And this one I wanted to bring up because I think with a little bit of bringing your experience as nurses in may help here. And don't negate that when you're looking at these test questions, okay? If you look at these and sort of use some of the stuff that you already know, it may help you. So I wanted to review this. So a patient presents, and remember I told you to read through the questions carefully. A patient presents with flank pain. You know what that is. It's sort of TL junction, thoracolumbar junction, that flank pain, and anuria. I'm sure you know that. A means without as a prefix. Poly means an increase. I'm sure you guys know that. But here we are breaking those words down. Okay. So a patient presents with flank pain and anuria. So they're not going to the bathroom. They're catheterized and then they go a lot. I'm sure you guys have seen this a million times. And probably what do you think causes that? Okay. I'm not even a nurse. And I was like, well, it's got to be bladder, right? Somewhere. If you're catheterizing and immediately going. So once again, a patient presents with flank pain, anuria, followed by polyuria after undergoing catheterization of the ureters, the most likely cause. Okay. So going through, I would not think pre-renal injury because I'm thinking bladder, right? Intrarenal would mean in the kidneys. Renal means kidneys. I wouldn't think that either because I'm thinking it's bladder. Acute tubular necrosis. Okay, where are the tubes? Okay, I think that they're referring to the nephron here. This is the one that I would pick out of these choices. Post-renal acute kidney injury. And that indeed is what the book was getting at. Okay, so the point in me going over that question, I would like to bring up a couple of these questions every week to reviewing, that we're getting into things, to review some of the tips that I give people on reading those questions. Don't forget your experiences, okay? A lot of you have been in practice for years. Use it. Use that experience, okay? So, last but not least is the last set of notes for chapter 33. And with this, that's my dog, excuse me. My apologies, I am back. And this is the last slide that I wanted to review. And this is your last set of slides on some of the pathology or pathophysiologies of the urinary system. And I wanted to go over this question. This topic comes up often in the nursing path classes that I've taught. And this question, once again, if we read this, I want to point out proteinuria, O. Hypoproteinemia, O. In England, Britain, across the seas, they spell edema with an O. O. Nephrotic syndrome. You do have hyperlipidemia as well. So with this one, as you read through, of course, read carefully, read every word, etc. But there seems to be, from the classes I've taught, a lot of review of nephrotic versus nephritic or glomerulonephritis, excuse me. So with nephritis, so nephrotic, your O's and hyperlipidemia. And then I'm pretty sure, and once again, I'm not giving anything away. I just want to point this out because I've seen it often. I've not even looked at the exam for this class yet because I'm just an adjunct starting to teach it. But glomerulonephritis post-strep is usually a really big sign. And then hematuria. Oh, there it is. Hematuria and hypertension. Okay, so for some reason that comes up a lot. So I wanted to bring that up to you. Okay. I think that's it for review. If you need anything, by all means, reach out and I'm happy to help. Have a great day.